First, I'd like to ask you for your permission to use this video for educational purpose and to use it on internet.
Yes.
Okay, now we did a thoracic fusion a few years back, right? When was that? When did we do that thoracic interbody fusion?
Last November.
Last November. So so it's not even a year back. It's about 7 months back. Did that surgery by itself? Did that help you?
It did, but I'm still feeling upper.
Yeah, you have symptoms above that region, and that's why we did actually a discogram. And the discogram that we just did says that actually the two discs directly above where we did the surgery are all right, but you had 8 of 10, 5 of 10, and 8 of 10 concordant pain, meaning when they increase the pressure, you actually had your usual pain there.
Yeah.
No, but the pain that you're having, I understand, you still have pain, but when we did the surgery 6 months ago for that lower pain, how much of that lower pain was gone after the surgery?
I'd say probably 70% of it.
70%. So that surgery was worth it for you?
It was.
Okay.
It was.
But now, obviously, we didn't fix all your problem.
Right.
Unfortunately, the Lord didn't bless you with the best kind of bones and the disc and so on. Describe for people who don't know that how it is to live with the pain that you have. Now we know, and again I'm turning around and showing that how in those levels the contrast is extruding out. Look here, that is practically leaks out. That discs are not good discs. They can give you your pain. But for people who don't know that, describe, how is that?
It feels like I'm in a vice grip, like someone's sitting on my chest and sucking the air out of my lungs. It's burny, it's stabby at times. It's hard to sleep, it's hard to walk, it's hard to stand. Some days the pain is so bad that I want to throw up. It's hard to keep food down.
Yeah.
It's not a quality of life to live.
Yeah. And how old are you?
I'll be 40 next
and
month.
You just told me that somebody with 40 shouldn't live like that.
You shouldn't have to live like that.
Yeah, no. The thoracic region is a holy grail of the spine surgery because you have to go through the rib. And generally, to do a surgery there, we have to open up the chest, collapse the lung, sometimes resect the rib. We try to usually stay away from that. And you notice that I'm struggling as well.
Right.
Put you through another surgery. And my question is always to you is there any way you can live with that? Because most of our colleagues actually don't even give you that choice. They tell you, too risky, go live with it.
Right.
Is it livable?
Right.
Do you think your situation is livable?
I don't. I've tried for a long time, and I don't want to live like this every day, feeling like this.
Yeah, and we have enough evidence to see that this truly is not in your head. It is in your disc, that the discs are gone and the bone is grinding the bone, and you have typical symptoms of that. It just yet is that the open old-fashioned surgery is too risky, and we don't give that option, except if you have a trauma like a broken bone and so on.
Right.
In our surgery, we make a small incision and we go and literally take the bad disc out, put a spacer in and so on. But you and I, we have been following each other for years. You see me for years, and you notice that I take it very seriously. I do not take it lightly to give you that option. Now, what have we done so far to try to control this pain?
I've done medications, physical therapy, several rounds of physical therapy. It hurt more than it helped, I feel like. I've tried breathing exercises and meditation. I do physical therapy exercises at home. I have my equipment. I've tried to lose some weight.
But it's hard to lose weight when you're in pain.
Right. It's very hard to lose weight.
That is another almost cynic thing that we neurosurgeons sometimes say. We know that if you have higher BMI, it put more pressure, and as well surgery becomes sometimes in open surgery more difficult. We tell our patient who cannot even move, go lose weight and come back. I mean,
it's very
cynic.
difficult. It is.
Yeah.
but I cut out soda. You know,
Yeah.
I just started just drinking water, and it's try to do high protein, low carb. It's just it's very.
So in our protocol, you qualify for the surgery, but I'm still going to do few more steps if you let me do
Yep.
my homework. And my homework is, you have other problem in other areas,
Yep.
which are easier to deal with. I'm going to deal with all of that first.
Yep.
And if sometimes, the way I compare it to my patient is like, imagine two bullies are beating you up in the schoolyard. If I
Right.
take care of one of them, can you deal with
Yep.
what's left?
Gotcha.
So we're going to look into, you have some neck pain as well. We'll look into that, see if we can fix that. And if we fix that, we can see if your life become livable. And that's all what it is. It may not be perfect,
Right.
but if it's
Manageable.
livable,
Yep.
and you are in charge of that, telling if it's livable. But once we have gone through all of that, even more physical therapy, more management, and I want you to go and think about it, because we should never take a decision for the surgery lightly.
Okay.
But if at the end of that road, if you let me, give you a little more time, a little more consideration, and if we still cannot make you comfortable, I will give you the choice of fixing
Okay.
this. Because what we did, we made the 8-hour surgery, a 1.5-hour surgery. I have done 3 levels and so on. It even though we are good at it, we will never take that decision lightly.
Right.
Okay, but on the other side, you're absolutely right. You should not live with that pain, because if you're in pain all the time, life is not worth living.
Yeah.
Yeah. What would you like that people in your situation know about your life and so on? That what would you like to share with people who go through the same situation?
That there's hope out there.
Yeah.
That it's not worth to just give up and keep fighting, advocating for yourself, and finding doctors like Dr. Abbasi.
Thank you. I appreciate that.
Yeah.
Well, thank you so much.